Of course, he was very professional, and I think that's so important, but his main objective was to make me feel comfortable, and to basically release any doubt that I might have still had within myself about my choice to come down here.
I was just pleasantly surprised the first night coming in to see the city at night and all the lights and how beautiful it was. And then the people are so gracious, and language hadn't been a problem. You know, we've been able to communicate enough to get around. I don't speak any Spanish. I wish I did. I'd move down here and stay with you. So it's been great.
The hospital is, it's beautiful. I think one of the first things I noticed about it was the cleanliness, spotless, no clutter. I also noticed that the medical staff in that entire hospital, there's no waste. They take a lot of pride in their work, and you could tell by the way they carried themselves and the way they respected the doctors they work for.
In my case, I've had several surgeries, and it's probably the only surgery that I've ever had that was totally painless. And I know that's hard to, you know, to believe, but even to push on the little incisions that were in me, they never got sore. They were never sore.
You know, waking up in recovery was fine for me. You know, I was ready to get up and walk to my hospital room, and I was ready. I was out shopping the next day, so I did well.
You know, the amazing thing about this is this process, I've never been hungry. And now, a lot of people ask me to explain that. I can't explain that.
I don't even know I have my band. I can't feel my band in my stomach. I can't feel my port. So other than my band reminding me it's there if I try to overeat or I don't chew well enough, I don't know I have a band.
Obesity surgery is not magical. Patients, you know, we're not, my professor, Dr. Roberto in Italy, would say that we didn't band the brain, we were banding the stomach. And patients had to be given support by, you know, nutritional support, motivational support by a multidisciplinary group. And so obesity surgery is not magical. You do have to work at it. A band is only a tool. It's a very valuable tool to help you lose weight, but you do have to work with it, and you have to get it adjusted.
It's not a miracle cure. It's a tool, no matter what form of surgery it is. It is a tool that you're given to help you to better your health, to better your life, and to give you longevity.
Actually, 6 weeks after the surgery, I came down and had the first field done, and that all went well. I'd lost 30 pounds at that point. So then, this is the first time I've been back since, and I've lost an additional 22 pounds.
I was close to 300 pounds when I started my surgery, and that was something that I was very ashamed of.
And I love what I do, not only because I see the benefit in my patients, but also because I've lived through it. You know, I've experienced it, and I've seen the change that we've had in our family, and my tolerance of physical activities, the way I'm able to, you know, keep up with my children. Now we have 4 children, and I'm able to keep up with their physical activities. And even though I'm a lot busier now than I was when I had my surgery, I'm still wanting to get away on weekends to enjoy with them, you know, enjoy life.
You're looking at a guy that's 70 years old, that had got to the point of in life that basically, as far as I was concerned, my useful life was pretty much done. I really was feeling that way. And when I come and done this, and then I started walking, because I tons of energy. I'd had energy to spare.
It's given me back my health. It's given me back my personality. You know, I'm a people person, but I'd become an introvert. You know, I didn't want to go anywhere. I didn't want to do anything. And now just, you know, there's something to do. If you don't ask me, I'm gonna have my feelings hurt. So
I feel very proud to know that he can really help other people to have the same changes that he has had.
I had a great experience. I have I think the only regret I have is probably the regret most people in my situation have, and that is I didn't do it sooner. You know, if I would have done this 5 years ago, where would I be? I may be president of the United States. No.
I'd say that Dr. Rumbaut has added at least 10 or 15 years onto my life, and I could not thank him enough.